Hello and welcome. Today, we're diving into a really important topic, especially for anyone in a caregiving role, and that's understanding HIV and AIDS. We're going to get a clear picture of what the virus is, how it affects the body, and most importantly, the huge role that compassionate care plays in everything.
Just think about that for a second. Your immune system is basically your body's personal army, right? It's there to protect you. But what if an invader was so clever it could actually hijack the generals of that army and use them to build its own forces? Well, that's pretty much the exact game plan of the human immunodeficiency virus, or HIV.
All right, so here's how we're going to break this all down. We'll start with the basics. What are HIV and AIDS? Then we'll get into the nitty-gritty of how the virus actually attacks the body. We'll talk about how it's transmitted, look at the stages of the infection, and then we'll wrap up with the caregiver's crucial role in all of this.
Okay, first things first, let's build a solid foundation. It's so important to get this next part straight because it's a super common mix-up. HIV and AIDS are not the same thing. They're related for sure, but they are two very different terms.
So HIV, that's the virus itself. Think of it as the invader. It's a blood-borne pathogen, which just means it travels through the blood and a few other body fluids. Its entire mission is to find and take over the very cells that are supposed to be protecting us.
Now, AIDS, on the other hand, isn't the virus, it's the syndrome. It's a collection of symptoms and illnesses that happen in the final stage of an untreated HIV infection. It's what happens when HIV has caused so much damage that the immune system is severely weakened, leaving the body wide open to attack.
So how does this tiny little virus pull off such a hostile takeover of the immune system? Well, it all comes down to its unique and, honestly, pretty sinister way of making copies of itself.
You see, HIV is what's called a retrovirus. Now, most living things work on a DNA to RNA blueprint, but a retrovirus like HIV does things backward. It carries its genetic code as RNA, and once it gets inside one of our cells, it uses a special enzyme to rewrite its RNA into DNA. This new viral DNA then gets inserted into our cell's own DNA, basically reprogramming it. Here's how that viral takeover happens, step by step. First, HIV hones in on a very specific target, the CD4+ T cell. You can think of this cell as the quarterback of the immune system. It calls the plays and tells everyone else what to do. The virus then latches onto and fuses with that T cell. Once inside, it hijacks the cell's machinery and turns it into a virus-making factory. Finally, the cell is destroyed, releasing thousands of new virus copies that go out and hunt for more T cells.
And this chart, wow, it really shows you the impact of that process. A healthy person has a CD4 count of 800 or more, but as HIV destroys these cells, you can see the count starts to drop. Once it gets below 500, the immune system starts to have problems. And when that count falls below 200, the system is so weak that a diagnosis of AIDS is made.
Okay, so we know how the virus attacks, but how does it actually get from one person to another? This is such a critical piece of the puzzle because knowing the facts here is the best way to fight fear and misinformation.
HIV can only be transmitted through contact with a few specific body fluids from someone who has the virus. And those are blood, semen, vaginal secretions, and breast milk. And for transmission to happen, the virus needs a direct path into the bloodstream, either through a break in the skin or through a mucous membrane.
Now let's be absolutely crystal clear on this point. HIV is not spread through things like hugging, shaking hands, sharing a toilet, or from a mosquito bite. You just can't get it from everyday casual contact. So much of the stigma around HIV comes from misunderstanding this one fundamental fact.
So the main ways it is transmitted fall into three categories. The most common is through sexual contact, especially unprotected sex. It can also be transmitted through blood, like from sharing needles, or in a healthcare setting from an accidental puncture wound. And finally, it can be passed from a mother to her child during pregnancy, birth, or breastfeeding. But here's the amazing part. With proper treatment for the mother, that risk of transmission plummets from about 25% all the way down to less than 2%. That's just incredible.
So, what happens inside the body after someone gets infected? Well, if it's left untreated, the disease tends to follow a pretty predictable, although often very slow, path.
And this timeline really tells the story. Within a few weeks of infection, there's an acute phase, which often feels just like a bad flu. Then, the virus can enter a long asymptomatic period. We're talking up to 10 years, where the person feels perfectly fine. But during that whole time, the virus is still active, quietly destroying those CD4 cells. Eventually, the count drops so low that the body enters the final symptomatic stage, AIDS, and the immune system can't protect itself anymore.
Now, when the immune system gets that weak, the body becomes vulnerable to what we call opportunistic infections and cancers. These are illnesses that a healthy immune system would just bat away without a problem. But for a person with AIDS, things like oral thrush, neurological issues, and aggressive cancers can take hold.
And one of the cancers most famously associated with AIDS is Kaposi's sarcoma. As this quote explains, it's a direct result of that severely weakened immune system, and it often shows up as lesions on the skin.
So, all of that brings us to the human response. Because of amazing advances in medicine, HIV is no longer the death sentence it once was. And in its new reality as a manageable chronic condition, the role of caregivers, like nursing assistants, is more critical than ever.
And that really is the core question for anyone in this line of work, right? It goes so far beyond just managing physical symptoms. It's about supporting the entire person. So the crucial point is this: the answer is all about providing holistic support. Yes, that means physical support, helping with daily life, keeping an eye out for any changes in health. But just as important, if not more so, is the emotional support. Just being a compassionate, non-judgmental presence can be incredibly powerful. It's about providing humanistic care, seeing the person, not the diagnosis.
And of course, caregivers have to operate within a really important legal and ethical framework. This means things like making sure there's informed consent for testing, always protecting a patient's confidentiality, and at its core, upholding the duty to treat every single person with dignity and respect, no matter their HIV status.
And this is really the most important takeaway. Thanks to incredible medical breakthroughs, people living with HIV who have access to treatment can live long, healthy, and full lives. It's become a manageable, chronic condition. But the medicine is only one piece of the puzzle. The other absolutely essential piece is compassionate, knowledgeable, humanistic care. So I'll just leave you with this last thought to chew on. We've gone through the science of the virus and the progression of the illness. But beyond all of that, how does the simple act of compassionate, person-to-person care actually change the story, change the entire experience of living with a disease like HIV? It's something truly powerful to think about. Thanks for joining me.